In 2009, the Canadian Diabetes Association commissioned a report, An Economic Tsunami, the Cost of Diabetes in Canada, to determine the cost of diabetes, including the impact of lost productivity on the Canadian economy. The report also evaluated the potential benefits of initiatives designed to delay or prevent the onset of type 2 diabetes and reduce the occurrence and severity of complications arising from the disease. The Manitoba Diabetes Cost Model estimated that 94,000 people in Manitoba had been diagnosed with type 1 or type 2 diabetes in 2010, which represented approximately 7.6% of the population. This number is expected to increase by 45,000 over the following decade to 139,000, or 10.1% of the population of Manitoba. The economic burden of diabetes in Manitoba is estimated to be $498 million for 2010. This cost is expected to increase by 28% over the following decade to $639 million by 2020. The number of people diagnosed with diabetes in Canada is estimated to have doubled between 2000 and 2010, from 1.3 million to about 2.5 million. More than 20 people are diagnosed with the disease every hour of every day. While the number of diagnosed Canadians is large, it is estimated that an additional 700,000 have the disease but don't know it. From 2010 to 2020, another 1.2 million people are expected to be diagnosed with diabetes, bringing the total to about 3.7 million. These increases escalate the share of the total population with diabetes from 4.2% in 2000 to 7.3% in 2010 to 9.9% in 2020. Rising obesity rates, sedentary lifestyles, an aging population, and changes in the ethnic mix of new immigrants have, and will continue to, drive these increases. Diabetes is a personal crisis for people living with the disease and for their families. Diabetes is also causing a financial crisis for our healthcare system. Treatment of the disease and its related complications are consuming an ever larger share of healthcare budgets and will soon force a tremendous increase in those budgets. Both personal and policy changes are needed. Every 4 hours, there's one amputation in Ontario as a result of a diabetic foot ulcer. Of the 1.6 million people with diabetes in Ontario, between 16,600 and 27,600 are expected to have a diabetic foot ulcer in 1 year alone. Each year, close to 2,000 of these people will have a lower limb amputation, and those amputations are associated with 800 premature deaths. Most of these amputations can be prevented if properly treated. Diabetic foot ulcers currently impose direct healthcare costs of $320 to $400 million and indirect costs of $35 to $60 million in Ontario. When a diabetic foot ulcer heals properly, a person spends approximately 5 days in the hospital, ER, and clinics. With lower limb amputations, a person spends approximately 86 days. Diabetes Canada estimates that funding towards this issue could save the government of Ontario between $48 and $75 million a year.